So you say no more bleeding gums, bad breath, loose teeth. You're treating it with a laser.
I'm telling you that the difference in treating it and doing this LANAP procedure versus traditional procedure is incredible. So first of all, if you've got bleeding gums and bad breath and your gums look red, I mean, you have a problem. Oh, by the way, you're also at risk for heart disease, stroke, and diabetes with those symptoms. CDC is very clear about the relationship of gum disease to those conditions that I mentioned. Well, there's a much...
Because why? Because you have an active bacterial infection in your mouth.
There is an active bacterial infection in your mouth. And the traditional way to deal with it, that periodontists have dealt with it over the years, is to make incisions, lay the gums back, clean things up, suture everything together, put bandages on there for 6 weeks. It really doesn't sound very comfortable, and I can tell you it's not. This is the number one thing that periodontists do, right? Day in and day out.
So you cut open the gums, you open them up, and then they clean this bacterial infection out.
Yeah, it's no fun. It's no fun.
All right.
Yeah, but now LANAP, however,
the laser
it uses a laser. You don't have to cut the gums. The laser goes in all the diseased areas, it's attracted to the colored bacteria, zaps them, what we say sterilize the pocket. That may be a little aggressive, but then it allows healing to occur much more effectively than with traditional gum procedures.
So there's two ways to do it. Treat this bacterial infection by cutting it out in a way, right? Or by killing it with a laser.
Yeah.
Am I oversimplifying?
No, you're not oversimplifying. And I know which way I'd want. I mean, it's just much more comfortable using the laser. And again, many studies show much more successful.
So help me understand why, if somebody has loose teeth, that they're able to get stronger after the laser procedure.
Well, one of the things that happens with gum disease is you lose what we call attachment. Now, attachment is around the roots, around the bun, around the gums that holds the teeth in place. So what the laser does is it actually not only strengthens the attachment that's there, but it actually builds new attachment, which is groundbreaking. That's the holy grail in periodontal treatment. So we see people with loose teeth, besides all the other symptoms, that after the laser procedure, their teeth actually get stronger and they're not waving in the breeze like they were before.
Now, is this true also? People that you would have had to extract their tooth years ago, you're saving teeth with a laser too.
Absolutely.
Is that right?
Absolutely, because there were so many compromises with the old style gum treatments. Like if you saw a tooth that was questionable, you didn't want to leave it in there because it may affect the tooth next to it. Well, we know with the laser, what we're creating with the bacterial population, that the infection is gone. So we can afford to wait longer to see if that tooth is going to respond.
Is it okay to have a little bit of bleeding when you floss?
If you woke up in the morning and looked in the mirror and there was blood coming from your eye, just a little bit, what would you do?
Is that a fair comparison?
Yeah, well, you know, it is. It is. I mean, bleeding is a sign of infection. And we all know that an infection anywhere in the body is not good.
So how soon does that go away? You go around the mouth with a laser. How soon does the bleeding stop?
Well, the bleeding will stop instantly. And then the healing process starts. So once healing has occurred, you know, then we evaluate for any residual bleeding points to see if there's infection going on there or if it's just part of the healing process.
So people are going in for gum surgery. You say maybe cancel and at least get a second opinion.
Well, I know from what I know and practicing for 30-something years that of these two procedures, there's no doubt in my mind which one I would want. And I'll tell you, a lot of our patients that we do this procedure on, they have been recommended traditional gum surgery many years ago, which of course sounded horrible to them. So then they find me and they're, yeah, this sounds much better, and they're getting the procedure done.